Good afternoon. Thanks for coming to this press briefing on the situation in Haiti. As expected, the number of cases of cholera and deaths are continuing to increase. The latest figures from the Ministry of Health show that more than 4,700 cases have been reported and 337 deaths. Cases have been confirmed in 3 provinces, including Arbanite, Central, and West. Suspect cases are being investigated in other provinces, including the North, Northwest, and Northeast. At this point in time, the specific numbers of cases is less important than knowing where the cases are occurring, their geographic distribution. So interventions targeted to the community as a whole can be implemented. The reported case fatality rate among hospitalized patients has ranged from 2% to 6.8%. Although the case fatality rate appears to be improving since we last reported on it when it was close to 9%, this higher than expected case fatality rate is mostly due to geographic and logistical challenges to accessing health services. Put simply, many patients have arrived too late to the health facility to receive treatment that could have saved their lives. It's very important to monitor the case fatality rate, to refocus and prioritize the training of healthcare workers, as well as to prioritize the support to families and communities. With continued improvement of prevention and treatment practices, the death rate should continue to decline. To that end, health and hygiene messages have been developed by the Ministry of Health in Creole and have been distributed to the public. These messages focus on hand washing, good hygiene and sanitation, such as proper management of human feces and garbage, purification of drinking water by boiling and using the chlorinated tablets, and eating only cooked or peeled foods. These messages also describe how to prepare the oral rehydration salts, how to care for cholera patients safely in the home, and when to recognize when to take patients to the health facilities. All these measures work when done effectively. They work to prevent continued spread of the infection as well as the deaths. We also now have data on the age distribution of hospitalized patients, at least from the Arbanite department, where most of the cases have occurred. Between October 20th and October 28th, 88% of the hospitalized patients were 5 years or older, meaning that 12% were younger than 5. In addition, we have information that approximately half the deaths or the fatalities occur among people never reaching the hospital. So they're occurring out in the communities and neighborhoods themselves. The UN response is coordinated through several clusters: health, communication, water and sanitation and hygiene, logistics, education, and protection, with the support of the Office for Coordination of Humanitarian Affairs. As head of the health cluster, PAHO has the responsibility of ensuring the coordination of the agencies and the organizations providing services to Haiti is most effective and properly managed. Many countries and organizations are involved with these efforts, including the United States, Argentina, Brazil, Canada, Cuba, Spain, Israel, Peru, Ecuador, Mexico, France, Japan, and the Dominican Republic, among others. Many NGOs or non-governmental organizations are actively involved in the response, including the Red Cross, Doctors Without Borders, and Partners in Health. Haiti's Ministry of Health has asked these partners to prepare at least a 6-month work plan, a plan that would outline their response and contribution to controlling the outbreak. The ministry have asked its partners to make the resettlement camps for the internally displaced people from the earthquake a top priority, since their living conditions make them particularly vulnerable. One of PAHO's focuses is to increase infectious disease surveillance in these camps as well throughout the country. We cannot overlook the vulnerable populations who do not live in these resettlement camps and may not have access to safe drinking water. The response must be comprehensive. An emerging top priority now for all of us is preparing for Tropical Storm Tomas. We've received reports that the storm has already had a serious impact on St. Lucia, with mudslides and severe damage to the island's water systems. If the storm hits Haiti, it's obvious that it will make a difficult situation worse. Cholera is maintained spread through contaminated water, and more water supply disruptions poses additional increased risks for cholera and other waterborne diarrheal diseases. The bad sanitary conditions in many areas, combined with what the hurricane poses as huge amounts of rain and possibly flooding, they're very likely to accelerate the spread of infection, making the overall caseload increase earlier and faster. At the request of the Haitian government, PAHO teams are currently visiting hospitals and cholera treatment centers to determine their readiness for the storm and to provide extra materials or medical supplies or even training where needed. PAHO is mapping out the locations and operational capacity of these facilities and contingency plans for the storm. And these may include the transferring of patients to more secure locations if necessary. While many precautions have already been taken, a lot more work needs to be done. As I mentioned in my last briefing, the strategy developed by the Haitian government's Ministry of Health to guide the response focuses on 3 lines of action. First, the response focuses on the protection of families at the community level. Second, the strengthening of primary health care centers in the metropolitan area. And finally, establishing cholera treatment centers and reinforcing hospitals for the treatment of severe cases throughout the nation. Since the start of the outbreak, PAHO has distributed over 3,500 liters of IV fluids, more than 64,000 sachets of oral rehydration salts, and more than 180,000 antibiotic tablets to treat patients suffering from the disease. These supplies have been distributed by PROMES, the PAHO managed warehouse in Port-au-Prince near the airport that is the main source of essential medicines and medical supplies in Haiti. PROMES distributes its inventories free of charge or at cost to hospitals and health facilities throughout the country, including many that are staffed by international non-governmental organizations. We now have teams from Argentina and Brazil helping the PROMES staff with the logistical challenges posed by the outbreak. Working together with the U.S. Centers for Disease Control and Prevention and other experts, PAHO has updated the antibiotic and treatment guidelines for cholera in Haiti. The recommended first-line antibiotic treatment for adults is doxycycline. Erythromycin or azithromycin is being recommended for children and pregnant women. I think I'll stop there and take any questions that you may have. Thank you.
Thanks, Dr. Andrews. Do we have any questions from people in the room? Okay, if not, we have a question from the Associated Press. Question 1 is, are there plans to change the course of treatment now that you know that it's a strain from Southeast Asia?
The answer to that question is no. The data that would influence any change in the antibiotic treatment would be the antibiotic sensitivity profile that the laboratory conducts. And fortunately, those sensitivity profiles indicate that this strain of bacteria is sensitive to the tetracyclines and the other antibiotics I mentioned, which is quite good because these antibiotics are quite available, they're cheap, and can be dispersed and are already in many pharmacies located throughout the country.
Okay, thanks. And we have another question from the AP. Are you going to investigate how a Southeast Asian strain got to Haiti?
Our job right now is to focus on preventing any additional deaths. Our job is to minimize the spread of this infection and to minimize the number of deaths that are occurring. That's our job, that's our prime focus. We don't have the role or responsibility to investigate where the bacteria came from. We know it's there now, and we must be totally focused on doing our job. Thank you, and thanks again for coming.